Hi, my name is Sean Kelly. I'm the Chief Medical Officer at Imprivata and also a practicing emergency physician in Boston at Beth Israel Deaconess Medical Center and Harvard Medical School. Today, we're going to talk about COVID-19 and how customers of Imprivata are using our technology to mitigate risk and manage response to the pandemic. So workflows in healthcare were complex to begin with. The old days of having all of our users in four walls of a hospital with simple workflows are long past, and things were getting more complex even before COVID-19. There were expanding numbers of users and roles that were necessary, from just clinicians to all the other staff around us that help us all do our jobs. And then more and more locations where we need to do work from and access our digital platforms. We work from home, we work on the road, we work in offices, and we use a number of different devices to get online and do our work. We might use more and more smartphones and mobile platforms now than we used to. Sometimes these workflows are delivered via virtual platforms and VDA infrastructure. And that's only been getting more prevalent before this pandemic struck. And we've had the need to go ahead and access many different apps, not just our EHR, of course, which is incredibly important, but a number of other third-party apps to do our jobs properly. So this was all complex before this crisis hit, and now that it has, that has infected our workflows even more. We've had to ramp up, and due to surge in patient volume, we need to rapidly increase our staffing and even rotate between different hospitals and different departments. So that has really placed a stress on the staffing for the different users and roles. And as you can imagine, from different locations, just like the rest of the world, we're doing a lot more work remotely as a physician and nursing workforce. And so that has its challenges, which we're going to talk about later in this segment. I mentioned before that the workflows were complex and that we use a lot more mobile devices. That's certainly even more true now. Everything from patient devices to provider devices to help reduce infection control risk, and also just to allow us to do our jobs in an increasingly complicated workflow world. And then, as far as apps, certainly we still need to get into our EHR just like we always did, but there are even more challenging things we have to do. We're constantly trying to access information like policies and guides and epidemiologic information, as well as coordinate with other institutions around us now that this pandemic has hit. So it's really, this crisis has turned a complex world into a hyper complex. Of course, managing and securing digital identity is actually as important as ever, especially given these hyper-complex workflows. It's really the digital identity, it's the anchor and the control plane for managing the access, both from a security and a convenience standpoint, for all the workers trying to log on and access and transact in this digital world. Of course, one of the major aspects of controlling that digital identity isn't just allowing the access or the workflows, but actually being able to maintain audit trails for compliance and security afterwards as well. So how are customers using Imprivata solutions in their COVID-19 response? Well, first and foremost, they're using our technology to support staffing ramp up and rotating of staff to deal with a surge in patient volume, and then also staff attrition at the same time. They're also enabling inpatient telehealth consults as well as virtual patient visits with family, given the increasing restrictions on visitation rights in the hospital in order to mitigate infection control problems. And we also see just a number of other use cases, and we're constantly getting feedback from customers and working with them to help mitigate risk and manage response to the pandemic in general. One crucial use case during the COVID-19 pandemic is using mobile devices to allow patients to communicate with family and loved ones. During this time of greatly increased visitation restrictions, patients have been having a hard time communicating with family and other loved ones because those family often aren't allowed on site. So Imprivata, through mobile device access solutions, connecting up with ASCOM phones, for example, are getting devices into patients' hands and allowing for virtual visits to happen from the bedside to those family members and other loved ones who are outside the facility. This is a great solution because it allows for that personal and humane touch, but also because it decreases infection control risks and still allows for the best sort of care and satisfaction for patients and their families.
The Imprivator Mobile Device Access solution provides a quick, secure method for users to easily access applications on shared mobile devices. The solution is designed to simplify accessing applications without compromising on security, which helps drive adoption of these applications and mobile devices being deployed by organizations. During the COVID-19 pandemic, this workflow has proven useful for inpatient telehealth and for patients to communicate with family and loved ones virtually from the bedside. A great example is currently in use at the Royal Surrey NHS Foundation Trust. Patients can video chat with their family and friends using Ascom mobile devices and the Attend Anywhere application. However, clinicians need to log into the Attend Anywhere application first before the Ascom mobile devices can be handed over to the patients. This creates challenges with clinicians having to remember and enter in credentials on small screen devices, as well as safeguarding sessions between different patient video chats. The Imprivator Mobile Device Access solution addresses these challenges, and we'll show you this in a short demonstration. So here we have an Ascom Myco 3 device secured with the Imprivator Mobile Device Access solution. To access the device, users simply tap their ID badge onto the back of the device and the device is unlocked. Users can then launch applications such as Attend Anywhere, and Imprivator will single sign on their credentials into the application. When finished using the device, it can be locked by tapping the user's ID badge again onto the back of the device. So that is ready for the next user. When another user picks up the device, they too simply unlock the device with a badge tap. Any applications that were opened and or logged in by the previous user will be closed, ensuring there are no unauthorized access to applications and confidential data is secured. The user can then launch applications with single sign-on, entering the correct credentials to log into the applications. As we've demonstrated, the Imprivator Mobile Device Access solution provides a simple and secure method for accessing applications delivered on mobile devices. The solution frees up clinicians' time so they can focus on patient care rather than fighting barriers to access patient information. For more information, please visit the Imprivator COVID-19 page at www.imprivator.com/COVID-19 or contact your Imprivator customer care team. Thanks for watching.